talk and thanks, guys. All right. 1 second, everybody. Perfect. I can't speak and function at the same time. So we are really lucky to have Brittany Rosato with us today. Brittany is a music therapist with Notable Progressions Music Therapy Services. Brittany has worked with populations of all ages, from very, very newborn to very, very old, addressing developmental, cognitive, and biopsychosocial needs with ages ranging from birth to end of life. Brittany specializes in the use of music for appropriate stimulation for all ages. She's participated and assisted in research using music with young children to foster healthy development, along with music for older adults. And again, Brittany, we are really happy to have you here. This is many of us in the senior care world know that music is a really important tool for us to have in our toolbox. And I'm excited we have so many caregivers here with us today to learn more. So I will turn it over to you.
Well, thank you so much for being here this afternoon, everyone. I'm super excited to talk with you all about this because music can be such an effective tool, but it also can be, there's some things that we need to be cautious about when using music. So my purpose today is to equip you all with some music techniques that you can use, along with just being aware of ways to make sure it's safe and effective for the folks that you are utilizing it with. So I'm going to go ahead and share my screen. And yes, I do encourage you all, please ask questions all through. I do not mind being interrupted. I think the best learning happens when you ask questions and get answers in the moment when you see something. So I am happy to do that as we go. So the safe and effective use of music with seniors. So we have heard and we have seen that music is such an effective tool with older adults. I'm sure that you've seen the videos on YouTube with, putting a pair of headphones on. There's one in particular of an older gentleman that seems quite lethargic sitting in his chair, and he has his eyes are bright and he smiles and he sings along when he hears that music. There's the music in memory program. It's in movies such as The Notebook. I don't know if you all have seen that one, where a woman struggling with Alzheimer's is still able to play piano. And the movie Coco, the Pixar movie Coco, he sings to his grandmother and she's able to sing back with him. So we see this happening all the time. And that's all true. Those things do happen. And we want to foster interactions like that with music. But sometimes what we don't see is the negative effect that music can have on individuals as well. And it's just really important to know how to spot those and how to avoid them. So that's what we're going to dig into a little bit today. So why is music so unbelievably effective? This is pretty common knowledge at this point in time, but music affects so many different parts of our brains. Music stimulates more of our brain than anything else because it has lots of different components to it. There's language with lyrics. There's where mathematics and everything is processed in your brain, that the rhythm of music is activating that. It helps elicit emotion. It's everywhere. So it also can not necessarily change your authentic personality, but like if you're in a terrible mood and you listen to something upbeat, it can kind of change that. So it's activating that frontal lobe area as well. So it really is having both hemispheres of our brains work together, and there's messages being sent back and forth between the hemispheres of the brain more than anything else. And the corpus callosum that connects the two hemispheres of the brains, it's been found in research that very musically inclined individuals or people that have engaged in music for a lot of their lives, their corpus callosum is actually bigger. So the bigger your corpus callosum, the more efficient your brain is sending messages back and forth between the hemispheres of your brain. So music and language, really big brain stimulators, and music even more so than language, and it is everywhere. So all these little dots are the major areas that are firing when music is involved. The one that I find to be really interesting is this visual cortex here. Have you ever heard a song from, I don't know, your high school dance or something and closed your eyes and you can see it? Anytime that our brain is creating images like that, your visual cortex is engaged, and music can kind of take us back and give us that. Or people that maybe see images when they hear particular pieces of music or something, that's all activating that visual cortex. I think that's pretty neat. So a quote here from a psychologist, Joyce Brothers: music is stored in long-term memory. When we learn something through music, we tend to remember it longer and believe it more deeply. And that's true. So the reason that we find music to be so incredibly effective and quite incredible with our older adult populations is because they can remember it. You know, you sing a song that they haven't sung since they were 16 years old and they can sing every word. I'm sure you all can do it too. Jamming out to those tunes that you were driving down the street, you know, on your way home from school or whatnot. I bet you remember most of those lyrics. And so it's also because they're in the long-term memory practically immediately, they last there. They don't go away. So as we cognitively decline with older age and whatever else, what other limitations and challenges might arise with aging, and other brain diseases and whatnot, that music is still stored in that long-term memory. So it's deep in there. So it's kind of the last to go. So all of those things that you have seen on TV or whatever of people that might not remember their daughter's name or who their husband is, but can still play piano, that's actually true. So some uses for music for seniors at home or in any type of care facility that you may be seeing them. So preferred music for motivation. As we get older, it is much harder to do certain things, get up and move around. Maybe eating is the issue. Maybe it's exercise. Maybe it's socializing. All of these things that we know are so beneficial to our physical lives, our social lives, our cognitive lives. It gets harder because it takes more effort. Research has shown that preferred music has a much better effect than just any old music. So when you use preferred music, so that means if an individual likes country music, you're playing country music if you want to encourage them to, you know, get up and go for a walk, or if they're, you know, if you have a social endeavor that you would like them to participate in, using preferred music to motivate them to engage in those types of activities is going to work for you. Music for stimulation, often because of those aforementioned challenges and whatnot, sometimes isolation becomes an issue, and that causes our stimulation from day to day to go down. The less stimulation, the more cognitive decline we have. So it's really important to be giving good, positive, and safe stimulation to our seniors to continue activating that brain. And remember how much of the brain is activated by music. So when we give them music for stimulation, it's kind of like a workout for your brain. So it's like, all right, we work out our bodies. Why not work out our brain? And all those different components of music, we've got language, we've got rhythm, we've got melody, your visual cortex is engaged, your auditory cortex is engaged. Oftentimes we can get people moving to music, your emotions are going, you know, your pineal gland is activating, which is really hard to activate because it's really deep down in there. You know, all these different things are happening. So it's kind of like a workout for your nervous system almost. Using music for structure routines. So oftentimes we may forget what's coming next in our routine, or we need some structure to kind of help our brains go, okay, this is ending. Now I'm expected to do this. So music can be used for that. It can be used to either introduce the next thing that's coming, or simply something that helps to prompt what's coming next in a routine. So, I hear You Are My Sunshine. It's time to go turn on my coffee for my morning coffee, or just things like that to kind of help with structure and routine. It also kind of plays into that motivation piece, because when they hear, you know, when our seniors hear these songs and they know what's coming next, it eases anxiety. They're more inclined to simply go with the routine or have that structure laid out for them that really helps us function a little better. Everybody likes a little bit of structure. Structure is not a bad thing. Structure is quite good. We are beings of routine. Our brains just work like that. We like predictable things. Music to relax. So oftentimes our seniors are becoming agitated due to cognitive decline, agitation due to frustration that they're not able to do the things that they used to do. Maybe they're experiencing some anxiety because they notice things, or maybe they're getting, maybe they're experiencing some dementia, they're getting confused, and that causes some anxiety. Maybe they're feeling a little bit depressed because of a noticeable decline that they're able to recognize. All of these things are really difficult for anyone to deal with. So using music to relax and practice presence is really important. Just another reminder though, preferred music is typically the best way to do this. If you're playing something that is not enjoyed by the individual, it's not particularly relaxing, right? So if you don't like heavy metal and someone's playing you heavy metal and it's like screaming in the background and you're like, this is great, someone's screaming in my ear, whereas like somebody else might be able to go to sleep to that type of music. I had a friend like that. I had no idea how she did it. So using that music to help calm, relax, it's something familiar. And often when we have something familiar, it's much more calming. And just simply choosing music that has calming properties. So maybe a slower song, maybe a ballad, maybe something that kind of lends itself to a more calming tone. Music listening and music making as a coping skill. So a lot of our seniors don't have to have a passive music experience. They can have an active music experience. And music listening and being able to talk about the music, what's happening, maybe memories that the music has brought up, can really be engaging for them. It can be exciting to them. It can be a huge social tool for them to kind of share all of the experiences that they had with particular types of music or songs, or maybe they were a swing dancer and you're playing big band music, or maybe they, or drove their grandson around in their truck and they always played country music. All these different things can get them talking. And that is also very cognitively stimulating to get them to be talking about this and reminiscing. And reminiscence is good. Research has shown that, oftentimes we become a little sad and nostalgic when we reminisce, but it's good to reminisce. And music making as a coping skill. So instrument play is a huge, huge tool when it comes to experiencing negative emotions. So for example, if someone's experiencing anxiety or depression, making music and learning a new instrument is incredible. While you are playing the instrument, you're practicing presence. There's really not much else that you can focus on when you're playing an instrument, because typically it takes multiple hand positions. You're doing more than one thing. It takes a lot of physical multitasking. And when you're learning something new, you're obviously cognitively engaged as well. So that all of that to say that that's helping them practice presence. They also can, it's really good because you can goal set. So if you're practicing an instrument and you want to get better at it, you're setting a goal for the next time that you meet with someone that's teaching you, or have, a group that you're learning an instrument together. And then you're setting a goal for next time, and you're setting a goal for next time. So our individuals are looking ahead rather than getting stuck maybe in the past where they're thinking about things they used to be able to do, or maybe focusing on a decline. Whereas when you're focusing on learning an instrument, you're focusing on progress. And also music for the caregivers, music for you all. Using music, it can make your care more fun. And all of those same things go for you as well. The music making, the music as a coping skill, music to relax, music for your routines to pump you up in the morning. You all do such hard work, and using music for yourself can help you stay motivated, help you stay present in your care, and just help you get through the day. What you do as a caregiver should not ever be forgotten, that you need to be cared for as well. And music can certainly help you maintain kind of a good mental state to do what you do. Do we have any questions so far after those few techniques?
Folks, again, use that chat button if you've got any questions for Brittany.
All right, I will keep chugging along. And if y'all have any questions, go for it. So all of those things are really wonderful things that can be used with music. And we're all hoping that you get a really positive response from the individuals that you're using it with. A lot of times that's the case. But there are some situations that you should be aware of when you're using music with, particularly with seniors, but really kind of with everyone. So music can actually be damaging, particularly when we are really, really young, or we're getting to those older ages. You're more at risk for it to cause overstimulation. And overstimulation is when your nervous system is just on overdrive. There's too much going on. Your body cannot process it in time, and it's a really uncomfortable state. Think about like if someone was playing the cymbals in front of your face when you woke up in the morning, like right when you woke up in the morning, it's like, that's too much. You would not be comfortable as you're waking up having this huge, loud, crashing sound coming at you. Your body's like not ready for that. But that can happen kind of at any point in time, as our nervous system is either very mature or getting older. So that's something to be aware of. Some signs for that, if you're just looking at the individual, some signs is becoming agitated, a startle, so they, kind of jump to the music. If you're noticing that they're withdrawing, physically withdrawing, that might be a sign of overstimulation. Or if they become emotional, that could also be a sign of overstimulation. You can trigger a trauma response. Oh, I see a question. I caught that one. Do you suggest that someone with cognitive loss could wear head or earphones when listening to music? That's a really great question. And there is no one size fits all answer. My initial response is no, not quite, because oftentimes we can't monitor how loud or soft the music is in headphones. Now, if you just play music with a radio or something, you can kind of adjust and see how the person is responding to music, but it's really hard to put headphones on someone and right away, like, get it right. And that can be really overstimulating. And it often can be really loud. But it's kind of a trial and error type of thing. If you feel that someone is capable of listening to that very directly on their ears, then give it a shot. But I would just proceed with caution with that. That is one main area that we do see overstimulation. Oftentimes the pictures that you'll see online or whatever of using music with seniors has them in their headphones and they're all hunky-dory and whatever. But those are the good responses. There's also bad ones too. So if you see a negative response, I would just take them off and then try to start with a radio or something and more gradually play some music. So triggering a trauma response, this one is tricky because this can happen and we could have no idea what the trigger was. So really it's just our job to respond and avoid whatever that happens. So for example, I worked with a client that I used to work at a hospital, and she was in a car accident with her family, and she was in a coma state for quite some time. And when she finally was alert, she was told that her husband didn't make it. And we were in a session together and I sang a song and she was sobbing because that was the song that was playing right before the accident happened. And her husband was being goofy and they were making jokes about this song and whatever. And she had relatively recently found out that he did not make it. So drastic example, yes, but also one to note, we don't know often what has gone on in our seniors' lives. They've lived long, beautiful lives. It makes me think of the commercial. I don't even know what the commercial is for, but it touched me so much. The commercial of it's an elderly person and they look in the mirror and we see the younger version of them. It's a young man in a military uniform, or it's a young woman in a nursing outfit, or a young mother, things like that, as a reminder to all of us to remember like who these people used to be. So they've had this long life and you never know what's going to come up. So if you see extreme emotion when you're using a particular type of music or whatever, if you see that extreme emotion, make sure that you change something, because that could be a trauma response or triggering some memory that is traumatic. And trauma is interesting. That could be a whole talk. Trauma sits real deep in our nervous system. It's really complicated. It affects us very, very deeply. Prompting a painful memory, kind of similar, maybe not as drastic as a trauma response, but just so that it's not horrible to express negative emotion. We always say, oh, don't cry. Well, no, it is okay. It's okay to cry. And if a negative emotion does come up, that's fine, as long as individuals around the person that's experiencing that are equipped to handle whatever emotion is coming up from perhaps a painful memory. And it also we hope that everybody loves music, and we hope that it's going to be fun, and we hope that it's going to be something positive for them, but it can cause or increase agitation in individuals. This could be tied back to overstimulation, or this could just be I don't want this right now, and I can't really communicate that to you, and the person just becomes very agitated. That's something to be aware of with the headphone question, as well as if it's causing some agitation, because sometimes, this is my own theory, just in my experience, but sometimes I feel like with headphones, people feel trapped because it's like right here, and it's like they're looking around and all they can hear is this music that's right here and they can't escape it. So sometimes I think that kind of might cause some anxiety and agitation, but that's just from my own observations and experience. I have no research to back that up, just from observations that I have made. Questions about some concerns about music. I lost my chat box, so somebody will have to tell me if there's more questions. I must have minimized it and it's hiding from me now.
So no questions right now, but folks, again, please feel free to use that chat box if you have any questions.
So you all are totally capable of using the music techniques that we talked about. But if you're uneasy about it or you're nervous about it, there is help, there is support. So that's when you can utilize a music therapist. So a music therapist is simply trained to use music to reach non-musical goals. So as we mentioned, we're not even learning the instrument. This music is not necessarily being used for the sake of learning to sing or keeping a steady beat or, playing the piano beautifully. All of the goals that we're trying to reach with using this music have nothing to do with music, and that is music therapy. So, but the difference is, if you are seeing some things that might be challenging as far as responses from the individual, there's hope for you to kind of navigate that and figure out what you're seeing, and seeing if a music therapist who's trained to deal with those responses and adapt the music and you still be able to use it because it's a preferred modality and whatnot. Being able to continue to use it, but learn how to comprehend and identify certain responses that are coming from your individual. Sometimes a music therapist will just help you be like, oh, that's this, keep doing what you're doing. And then sometimes, you might need that extra training to really support the individual that you're working with to really benefit from music. So it being provided by a professional who knows how to adapt the music, change it, do different things with it, present it in a different way, counsel people through some of those negative responses and things that they may have when utilizing music. So when is it time to seek out a music therapist after you've kind of tried the music techniques with the individuals that you care for? If you're noticing intense emotional responses to music, so maybe not just getting tearful, maybe not, even extreme positive emotions, maybe not just like chuckling here and there, but if you're seeing like really intense emotions when you're using music with your individuals, there might be something going on there that's a little bit deeper than just kind of being like, wow, this is really nice, or oh wow, I have a nice memory. It makes me sad that that's over. This is a time that you might want to seek out a music therapist to kind of assess what's going on. Maybe they're a really emotional person, and that's fine. And then the music therapist will say, I think you're okay here. Keep doing what you're doing. It's a very emotional person. Or maybe something more is going on that the person needs to be guided into music a little bit, and a more gradual ease into certain music. Maybe they're not, maybe they don't know how to process the emotions that they're feeling on their own. A music therapist can kind of help with that. But yeah, so if you're noticing really intense and extreme emotions when you're utilizing music, that's a time that you can reach out. If there's little to no response to music, that might be a time to reach out, because perhaps a music therapist can give you some additional techniques and stuff. So like, for example, if you're trying to use music as motivation or for the structure and routines and it's not happening, you can have a music therapist consult and just say, hey, how can I, how can I use this better? And what are some additional things that I can do? Because maybe that music therapist can assess something else that's going on and give you some further ideas and kind of tweak what you're doing a little bit to get a better response from the individual. Have you seen a person with cognitive decline sing to music when they normally don't verbally speak much? Oh yeah, all the time. All the time. That is one of my personal just wonderful things about the things that I get to see in clients. Yes, I see that particular like amazing response more so than anything else. I have seen people that cannot or will not or both verbalize their wants, their needs, their interests, but they will sing anything you want them to sing. So that's another one. I mean, if you can use that music and them singing to kind of help motivate them to tell you things and share things with you and whatever, that's great. That's another time that maybe a music therapist can come in and kind of do some behavioral interventions to maybe get them to speak with you a little bit. But yes, so, and the reason that happens is because music does stimulate more parts of the brain than just language. So oftentimes our brain is more of it is working and it finds a way to get messages across. So for example, when your brain is damaged after a stroke, you go through all these rehabilitative therapies and your brain heals, but there's always a piece that is damaged and your brain figures out a way how to bypass that and do everything that it was doing before, just in a different way. So that, yes, that does happen. I've seen it often. Are there certain types of music that help with particular diseases or conditions as far as treatment, tonal therapy or vibration stuff? So that is not the tonal and vibration therapy. Some music therapists study that. That's not the primary treatment in music therapy as far as like board certified music therapists go. Preferred music is the key for what we do. But I also am a certified yoga instructor, so I know a little bit about that vibrational stuff. It kind of just depends on the person. I know even young people that are severely overstimulated by like sound bowls and things like that. So that's another proceed with caution type of area, but I don't know any specific research on tonal and vibrational sound therapies that are specific, but they do affect the nervous system a lot. And it's supposed to break up some holds and stuff that you may have, but I would proceed with caution with that just because the sound in those types of instruments that are being utilized, it's really hard to adapt and manipulate the sound. So like louder, softer, those instruments, they kind of are what they are. So if it's not soothing to the person or if it's not sitting well with the person, it's really hard to adapt and change. Whereas, music on the radio, you can turn it down, or like if you're using a CD, you switch to the calming track instead of the rock and roll Elvis Presley track, and you can turn it up and down. And so Great question. Another response that you can look for is if an individual becomes, and this is like what this slide here says, when to seek a music therapist. This isn't like a one-off time. We talked about some negative responses you may see. So you're aware of those now. This is if you're seeing them all the time. We certainly don't want to be doing damage with the music that we're using. So if this is something that like every single time you're trying to use music and you're seeing these responses, maybe it's time to check out like what's going on with the individual to see if you can adapt anything to make it better. But if someone is becoming physically rigid, agitated, or startles when the music is present, this could be for a variety of reasons: triggering, overstimulation, dislike, agitation, could be loads of things. If playing an instrument, so in the cases that you might be using making music as a coping skill or a technique that you're utilizing, if playing an instrument, the individual becomes really frustrated due to forgetting how to play, or they don't feel like they can do it or whatever, depending on the person, if you don't feel equipped to support them and counsel them through that, a music therapist can help you with that as well, whether it be actually working with the individual or giving you some techniques of how to support them in that learning process. Because it does become, it is frustrating, right? Think about the last time you learned something new. You want it right now. You want to do it right now. So if they're doing something new, it can be really frustrating and hard, and they may become very frustrated. And then you tie in other things that might be going on with the aging process, and that can become a little bit different than just your typical everyday frustration. And also the one that I really recommend seeking a music therapist for is music at end of life. And that's just because you as a caregiver give so much, and you deserve to have moments with at this time as well with individuals that you work with. So that is more to take the burden off of you of trying to figure out what music, because remember, at end of life, we still can have, some of those negative responses. So rather than thinking about that, trying to figure out what the best thing is, are they comfortable? Are they not comfortable? I really just want to sit on the bed and hold their hand and make them feel good and comfortable right now. That is a time that, as music therapists, we are trained for those types of situations to support everybody involved. So that's more for you all, and just being able to take that time to do what you all need to do during that process as well. But certainly recorded music at the bedside and everything during that time is appropriate, but also certainly a time that you can reach out for support and whatnot. So I want to go through those music techniques just one more time, now that we kind of talked about like the whole gamut, and return to these and see if you guys have any questions of how to incorporate these in with anyone that you're working with and whatnot. So preferred music for motivation, using music that the individual likes in order to encourage them to do things. Maybe that's being active, maybe that's being social, maybe that's, maintaining good care habits. Music for stimulation. So perhaps you would like, the individual to not sit in the recliner and watch TV all day. Maybe you would like them to do something that gets their brain working a little bit. You want that neurologic workout, using music for stimulation. So this would be more upbeat music. You might want to start slower and work your way up to more upbeat music, but just using that to kind of get them going, get their blood flowing, get them going a little bit. Using music for structured routines, so placing music throughout the day to kind of prompt what's coming next, giving familiarity, reminders, things like that. So using music as cues for those. Music to relax, maybe for agitation, maybe for anxiety, maybe trouble sleeping is another one, maybe at night. How sometimes our seniors get a little agitated at the nighttime, using music to kind of just bring them down and get them ready for bed. It can also be a really good bedtime routine tool as well. What instruments would be easier to learn for a beginner to avoid frustration? So drums are always great, and drumming is a really great way to practice presence. And then some of your more melodic instruments. Piano is really accessible when taught in an appropriate way. So piano is really accessible. And then our picture here on the screen is a ukulele. Obviously, an individual would have to still have pretty decent fine motor skills at that point, but there's ways to adapt a ukulele in order to be super easy and accessible for a beginner. Great question. You just kind of have to determine the cognitive abilities of the individuals that you work with as well.
Brittany, would you consider something like a tambourine or bells or maracas? Would those be considered instruments that could be used with someone who doesn't have dexterity?
Oh, sure. Yeah. Utilizing instruments as far as just, a lot of that is for stimulation. A lot of that is motivation. As far as like the making music and like that process that I was talking about, as far as goal setting and presence and things like that, those are the instruments that might be a little bit more complex. So like a specific drum to do specific patterns on, a melodic instrument, but using shakers and tambourines and things like that to get people involved and engaged in any type of active music making is always a wonderful tool as well. We kind of touched on that music as a coping skill, and then music for you all. I play preferred CDs with my dad who has dementia, and we both enjoy it, but he doesn't sing along. I'm not musically inclined. I do have a harmonica that was his. Yeah, so a harmonica, I feel, I actually don't know like how people learn to play the harmonica. I think they just kind of like figure out melodies and stuff on it. But it's very easy to play, and it's really good for older adults because you engage your core, because a harmonica has a lot of resistance. So when you blow, you're engaging your core, and you're also working out your lungs. So it's a really good tool for older adults. It's been used a lot with Parkinson's disease. A lot of anyone with individuals with Parkinson's disease, just shoot me or there's also a raise hand feature. I'm going to stop my share screen just for a second to see if any hands go up as far as Parkinson's, anyone caring for Parkinson's? Okay, if that is ever something that you all run into, singing, and anything that has to do with playing instruments and kind of helping to maintain muscle control and stuff is so good. But that oftentimes Parkinson's will, your vocal cords, this is all muscle in here, your vocal cords and everything, they're a muscle. So singing is going to help strengthen those. Oftentimes with individuals with Parkinson's, you'll hear their voice lowering, and we hear this in seniors as well, but this is all weakening. So with the neurologic challenges of Parkinson's as well, we have the whole gamut going on here. So singing it for breath control, singing for tremors because you're practicing presence, singing for strengthening your voice so that they're still able to maintain appropriate communication and verbal communication. A lot of those are good for all seniors, but particularly with Parkinson's, it's kind of like square on attack for those types of things. So that's all really, really good techniques to use with all seniors, but particularly those with Parkinson's or another neurologic diagnosis as well. What other questions do you all have?
Folks, use that chat if you've got any questions for Brittany. Brittany, does it matter if the music is live, if it's on TV, if it's on a CD? Is there a better method of delivery?
So As a music therapist, I always say live is best because it can be adapted. But if you don't have someone who knows to adapt, then it's kind of the same as recorded music. So preferred is my biggest thing. The modality of which it's delivered doesn't matter a ton. I think live music is always better because it can be started and stopped and, encourage engagement and, stopped for individuals to sing along and have solos and pause to play your instruments and all these. You can really manipulate like what exactly you're doing with it, which is always really beneficial to maintain engagement and whatnot in the music. But obviously a live musician is not always possible. So recorded is wonderful as well. The TV music channels, and then if you want a visual component, I mean, someone on TV, like playing an instrument or something is always great too, because there's that visual component. You see the emotion coming out of the musician and things like that. But preferred music is my like biggest takeaway. Use preferred music. Other than that, however you can get it for them is great.
Perfect. And folks, I don't know how savvy you are. I know here, we've got a big screen in our activity room, and we use a lot of YouTube music clips, and we can pull up requests that the participants have made or just things we think would be preferred. And it's really fun to see the video along with the music. So you can find just about anything on YouTube.
Deborah, who the harmonica question, I would be interested if your dad would sing along. If like a lyric was, if you're singing, I fell into a burning ring of, and then you left that for him to fill in, I'm wondering if he would fill it in for you. Give that a try. See if that engages him and encourages him to sing. I've seen videos of seniors using drumsticks, beating on yoga balls, perched on buckets, and playing along. Is this easy to use with dementia patients? Oh, sure. As long as you're not worried about the safety of the drumsticks going flying, that's fine. Yeah, that's great. A lot of that is used for movement, not necessarily the music, but the movement of moving the arms, and like they get the rebound with the yoga ball. It's not as hard for them to bring it back up, but oh, sure. Oh, I guess I just guessed the Ring of Fire. It's like a classic, everybody loves Ring of Fire. Yeah, I would try that. I would leave out some of those lyrics and see if he fills them in for you. And it doesn't matter. Also, for those of you that want to sing, oh, I can't sing. I hear you all. I can't hear you, but I hear some of you saying that. That doesn't matter. That doesn't matter when you're engaging these seniors. Just like when you have children, we always encourage moms to sing to their babies. They don't care how you sound. They just care that you're, it's something to bond you with them. Bonding is so important at all stages of life. They don't care if you're an opera singer. They care that you're singing to them. It's a song that they like, and you're having a moment together that you can share.
Brittany, so much good information. I so appreciate your time. Folks, we've got a few more minutes. If you have any other questions for Brittany, other ways that you might be able to bring music into your relationship with the person you're taking care of, how you can use music to help you. I really appreciate you bringing that component into the conversation, Brittany. That's really important for all of us.
Yeah, we kind of take on some of that fear and anxiety of our seniors sometimes, so it's really important to make sure that if you are feeling those types of things, that you have tools and stuff as well. And music is a great way to, the bonding is like that I was just talking about. That's a wonderful thing to use it for both involved. But also just for presence for yourself. I mean, I feel like we all, when we are working with seniors, do have a bit of fear of the future as well. And oftentimes they do too. So just kind of staying present, using the music to keep us in the moment. And that's what's important, is maintaining that moment. Oh, that's great. Lisa, some music therapists in your family. That's wonderful. We need more of them.
And
Sure. Sure. The question is, do you recommend using recorded music to help someone fall asleep too? So like white noise or whatever. Yeah, that's fine as long as it doesn't agitate them. And I would just keep an eye that, because often our seniors don't, go to sleep and sleep all night, that music isn't causing them any type of anxiety or alerting them or anything, or causing any type of confusion. If they wake up during the night and it's still going, you'd have it on a timer or something. White noise shouldn't bother them too much. It's just noise. I was going to say something about white noise, but it's not applicable to our seniors. I have a beef with children and white noise, but other than that, seniors, it's fine. I use it myself. Sometimes when I perform for seniors, I tell them I don't remember the words or need help singing, and I ask them to, yep, that's perfect. Yeah, I love that. Whoops, I forgot. I need your help. Yeah, and fill in some song or fill in some lyrics. That's great. Love that. Are there particular credential certifications or organizational affiliates that should be considered? Yes, absolutely. So a music therapist, you are looking for, that's a great question. Thank you so much for asking. So you're looking for the MTBC credential, music therapist board certified. So as music therapists, we do have a national certification. We sit for a board exam upon completing our academic programs. So you're looking for MTBC. That's the biggest one. And then the music therapist should be responsible for this, but there are several states that have state licensure as well. So you would want to make sure that your therapist, if you're in a state with state licensure, that they're licensed in your state as well. But yes, MTBC, that's the most important one.
Brittany, do you want to share how, if folks are interested in getting in touch with you or Notable Progressions, how they can do that? And you can share it, but then put it in the chat too.
Absolutely. So let me just, I'm going to get you, if you all are visual like me, I'll get you a slide. And also so if you're looking, if you need to look for a music therapist in your area, just for some advice or whatever, the certification board for music therapists, cbmt.org. You can search your area and all the certified music therapists in your area will pop up in that search. So this is us. We are in Maryland. We're in Frederick, Maryland. We serve both Frederick and Montgomery counties, and we'd be happy to help you navigate any of this. Even if it's just some questions about what you can do with your individuals, or if you're seeing something that you're not quite sure about, we're here to help and guide you in the right direction of using music safely with your seniors. So we're happy to help you. We're on Facebook, we're on Instagram. If you use those types of things, our website is there. If you have questions that can be emailed or give us a call, we're just here to help you and support you and, help you too. If there's something that you want to incorporate for yourself, we're happy to kind of help you navigate that and share some tools and stuff that may help.
Brittany, thank you again. A fantastic presentation. Folks, I'll say this is the last call for questions. If you have anything, please reach out to Notable Progressions or Brittany if you have more questions. This session was recorded. We will put it on our YouTube channel with the link from if you go to the espcfrederick.com website, on the very bottom, it's not real easy to find, but on the very bottom of the screen, you'll find a little red triangle. That's the logo for YouTube. And if you click that, it'll take you to our page that has all of the recordings from our past sessions. And in another week or so, our technical person is on vacation. So this one may take a couple of weeks before it's loaded up there. But if you want to share what you learned here today with other family members or friends, please do that. I want you to mark your calendars. July 13th is our next presentation. Andrea Leschek will be presenting to us navigating travel with seniors. Andrea is not local. She's actually a well-known national speaker who has got lots and lots of information about how you can travel safely with the folks that you are caring for. So I hope that you will join us for that. You can register on the ESPC website, and I'll make sure that you all get emails with those registrations. While I have you, I would like to get a little bit of feedback from you. You received the link to join today via the ESPC email. You also received one from me personally, and I just want to double check. I know we've had issues with the ESPC links, and I want to make sure that that worked today. So if that link did not work for you today and you had to use the email that I sent you personally, just if you could put that in the chat box so we can keep track of that, I'd appreciate it. So I'll also thank Hartfield's Assisted Living and Jennifer Minnick for joining us today and sponsoring our webinar. Please contact them if you would like more information about the services that they provide. And with that, I will say go forth and enjoy the day, turn up the radio, find some music that you love, and let it make you happy. So thank you everybody for joining us. We will see you next month.